uses as non-replicating virus to prompt the body to create antibodies to the spike component of the coronavirus. Janssen's vaccine can be stored in refrigerators, making distribution cheaper and easier. Joining me now from San Francisco is Dr. Stephen Parodi. He's the Associate Executive Director for the Permanente Medical Group at Kaiser Permanente. Doctor, thank you so much for joining us. I want to start with the news, the significance of lifting the pause on the Johnson & Johnson vaccine, releasing those 9 million doses that the U.S. has on hand. You help oversee some 20-plus hospitals, 4.5 million patients. What effect will it have on your staff's ability on the ground there to vaccinate Californians?
Well, this is a really big deal. I mean, it gives us the opportunity to have an expanded access to vaccine that we've had on pause for the last 2 weeks. And it's going to be really important in this effort to get to herd immunity. We're in a race against these variants. The more tools in our toolbox, the better.
Now, some CDC advisors say they're not happy because even though the vaccine label will note the risk, the rare risk of blood clots, we should say, there's still not enough guidance, they say, from the CDC about the risks. The CDC says they'll have to do some extraordinary outreach to doctors and patients on the issue. But is it enough? I mean, how will this change how you deliver this vaccine specifically to patients in terms of warnings and so on?
Well, number one, the CDC and FDA are going to formalize a warning. And then what we are doing in the process is actually taking that information, packaging it so it's available to our patients, to the general public in our messaging, so that everyone can make an informed choice. This is important to understand the risk and benefits of both vaccination, but also, as important, the risk of getting COVID. And I just want to make it clear that there is still a lot of COVID going around in the United States. Just here in California, we're still seeing a couple of thousand cases a day. That's a lot better than 40,000 cases a day, but we're still in the thick of it when it comes to this pandemic.
I mean, do you think, though, that the confidence in vaccines has taken a hit here? I mean, we've seen the trend on vaccination seems to be going down. We're vaccinating at a slower rate than before. Does it worry you that we might not get to the critical number we need?
I am concerned about that. If you want to think about it, J&J and having it paused really is giving everyone a bit of a pause when it comes to, should I get that vaccine? And so it's going to require a doubling down of our efforts to instill confidence. In fact, during my clinic today, when I was talking to one of my African-American patients, and we were talking about J&J, and I asked him, what's it going to take to reinstill confidence? And really what he said was two things. One is that someone in that household, someone that's living with the group of people that are thinking about getting vaccinated, they've got to be confident enough to get it. And then the second thing he said is they need to hear from their individual provider, whether that's a physician or someone that they trust as an advisor. And in fact, New England Journal of Medicine published today and showed that actually the most trusted people are the individual clinicians that people come to. So the reason I mentioned that is that we can have the most wonderful and excellent public health campaigns in the world, but I think getting to herd immunity is going to require literally a door-to-door type of approach where we're outreaching individual people, reinstilling that confidence.
That's interesting. That's a great message to get out there. I want to pivot to some good news. First of all, quickly on COVID reinfection, people who have been vaccinated and then come down with a serious case of COVID. From your experience, how common is that?
It's actually extremely rare. We've seen very few breakthrough cases after somebody's been fully vaccinated. So that means you've gotten, if you're in a 2-dose series, 2 weeks after you've gotten that second dose. It's extremely rare to see anybody get sick, and if they do get sick, extremely rare to even see a hospitalization. So I'm convinced these vaccines work. I've got to tell you, since we started vaccinating the older populations, the people in skilled nursing facilities, I'm simply not seeing those people get hospitalized. So it's really key that we move forward, we move fast, and that as this vaccine supply opens up over May and June, that we get to the larger general public.
A hopeful note to end on. Appreciate your insights, Dr. Stephen Parodi. Thanks again for joining us.
Thank you.
Large parts of Germany are beginning the day under new lockdown restrictions after the government passed what's being called an emergency brake law. It's aimed at tackling